Every hour, on average, 2 of our neighbors, family members, and friends are dying from COVID-19. The surge in COVID-19 cases in LA County continues unabated, and it's a near vertical line over the last several weeks. From November 1st through December 8th, average daily cases increased by 656%.
What a scary graphic, that arrow at the end there. Tonight, California, as you heard, surging past its single-day coronavirus records, adding over 41,000 new cases and, sadly, 300 new deaths to the totals. The state has activated what it calls its mass fatality program. That means the order of thousands of body bags, dozens of refrigerated storage units for temporary morgue use. We welcome Dr. Simon Mates to the broadcast tonight. He's co-director of the ICU at Dignity Health California Hospital and Medical Center in downtown Los Angeles. And doctor, I note LA County today, all-time high in terms of deaths and cases. The average wait time for an ambulance now 45 to 75 minutes. Does this feel like the Thanksgiving, post-Thanksgiving spike to you? Has this been a fast ramp up or a gradual climb?
So compared to the past 2 surges, this has definitely been a rapid surge, and that's basically consistent with what we expected.
And what has it been like to be at the center of this, to go from weeks where you thought you may have it handled, weeks where you thought maybe we don't have to move to that new ICU ward, maybe we don't have to do triage in the parking lot? How much margin of error do you have now?
Well, I kind of see the first 2 surges as a dress rehearsal for what we're going through now. We've expected this to come. We've been planning for this, and right now we're able to handle it. So we're pretty confident with where we're at, honestly.
Give us some good news. If I arrive at the ICU presenting with coronavirus symptoms, difficulty breathing and the like, what is my survivability in the hands of your professionals now, as opposed to those first cases through the door, say, in March?
So I think we've learned a lot about this virus over the course of the past 9 months. I think we've realized that miracle cures are really not the answer to this. We've got to go back to the basics of ICU care, and we've been focusing on that, and that's really been working for us. Our mortality rate, our morbidity rate is lower than average, actually, in our hospital. And that's what we're focusing on. We know what we need to do for these patients, and we know how to do it. And it's just all about, going back to basics in terms of the ICU care.
Is it still true that ventilators in way too many cases result in fatal cases?
I think that that's a big misconception that the public has, is that ventilators kill people or that there's something wrong with a ventilator. A ventilator is a great tool used properly. It allows your patients to rest. It allows the body to heal. The best tool that you have is your own body. And what we're doing is just supporting the healing process of the body, really.
Yeah, I think around here we just heard so many medical professionals at the height of it say the minute you put a patient on a ventilator, that reduces the odds that that patient is going to walk out of the hospital, just speaking to how sick they were. Final question, is there a date you carry around in your head where you are hoping through public health and the vaccine finally reaching enough people? Is it summer of 2021 where you expect to see life something closer to normal in Southern California?
Yeah, I'm definitely hoping that I think in the short term, I'm looking at the end of January. I think that we're going to continue to surge through the holidays. And I'm hoping that by the end of January that kind of peaks and then begins to trough. And then definitely looking forward to the spring and summer as we will be able to start vaccinating the general public and hopefully getting this under control.
Thank you very much for making time for us tonight and taking our questions. It's been very instructive. Dr. Simon Mates with us from
My
Los
pleasure.
Angeles tonight. Coming up for us.